Good morning, everyone. I would like to showcase Metro Hospital Management System. As soon as you logged into the system, you will have a couple of modules open in front of you. It's a single login authentication system. Although it is very secure, it role-based access where you will have specific access to specific modules based on the roles. As I have logged in as super admin, I have access to the entire modules. So the modules are doctor CMR, electronic medicals record, nurse electronic medicals record, nurse EMR, front office, which is for billing and appointment scheduling, all those kind of things. Pharmacy management system, where it is you can use it as standalone, and but it is an integral part of your software, where all the pharmaceuticals product you can sell. Radiology, lab, laboratory management. It has machine integration, insurance or revenue cycle management, where all the insurance activities you can do. Store management, basically it's an inventory management where you can create products, purchase request, good receipt notes, all those kind of activities, stock transfer, and it is integrated with the system in a way that each and every items you are using, it will be having billing or it has to have consumptions. Finance and accounts, human resource, masters were creating all the masters, reports, 100 of reports are there relevant to the system. OT is operation theater management and token management system. So I'll show you a high level overview how we will take a patient journey through our system. So first we'll go to the front office to take an appointment. So in the front office you can see first that the number of appointments we have today, the month and the year end. So in the appointment section, we have doctor-wise appointment, multi-doctor-wise appointment, procedure-wise appointment, and multi-procedure-wise appointment. And there are other options to create the procedures, booking, and other things. So what does it mean? Why there are a couple of things? So doctor-wise appointment, this is the functionality and the user friendliness of the front office. They can use either options. So on doctor consultation, the procedure booking. So normally what happens that doctor-wise appointment, if I go to book an appointment, normally you can see the plus button and there is another button, up arrow. So up arrow, if I click, I can book this, block the slot. Basically, suppose as a doctor he needs to do something urgently, then you need to just click on the up arrow. And if you want to unblock it, just as easy as it is, you can just click on that up arrow, again down arrow, again it will be unblocked. So now I want to book an appointment. Suppose I want to book an appointment at 12:15. This slot is available. Plus icon, there are three tabs you can see. I'm redirecting from the single screen. You don't need to go multiple screen. Basically, it's a user friendly system. So we are saying in the same screen I am navigating to other screen. So I clicked on the plus icon, I could see there are three tabs basically. So old patient means the patient who has files already with us. I can search with the patient ID, name, CPR, and phone number, either way, so it will match. With the phone number it will start matching, and then if I search with the name it will start matching. I'll take an appointment with patient ID basically. So I'll be taking, suppose, Abdullah, patient ID 4, P84. So Abdullah Wadi. I can change the number of slots here if I want to. If I need to take two slots, I can do it from here. Yeah, another is that appointment patient is calling over phone or the patient is here to take the appointment. So if it is patient, normally walk-in patient, we select walk-in patient. Otherwise, it's an appointment through phone call. We can write a note. Suppose patient is coming for follow-up, and then say it's pretty simple. My appointment is booked at 12:15, Abdullah. After the appointment booking, normally business they call to the patient for confirming. So for that, if I click on the tick icon, the appointment is confirmed and the patient will get a confirmation SMS. In both cases, as soon as patient will take the appointment, they will get they will get an appointment notification, and after that again they will do the confirmation. It's business rules again. If they want to have one or two notifications, either way it's a configurable. So after the appointment booking, you can see there are a couple of icons now available. What does it mean? The dollar icon, it means that you, some business, some healthcares, what they do, they let the patient go without charging to them prior to the consultation. So patient doesn't need to pay prior to the consultation. Doctor will decide how much to be charged. They will put all the procedures and all, and then it will redirect to the billing screen. So for that, you need to just click on the stato icon. Then you have edit option. You can reschedule the appointment. You can delete the appointment also. So for charging to the patient, same screen, I'll click on the dollar icon. It will redirect to another screen, to the billing screen. It's capture all the patient name, ID, mobile number, everything. You don't need to search it again to do the billing. I can do cash and insurance also in the same screen. The patient doctor name is already there. Charges already captured. Patient has 10 BD. Patient has to charge 10 BD. And if I want to give discount as a percentage wise of 10%, it will show that how much 1 BD has discount. I can give 4 BD discount. It is how much it is actually 40% discount I am giving. So patient has to pay 6 BD. And then you need to save it. So once you will save, you can get a notification because I gave the discount. I need to write the notification reason that why I'm giving the discount. Suppose management request or management approved it. Management approved. And there is another option called coupon apply, means coupon discount. If there are number of coupons you are generating and providing to the patient for campaign or anything, once patient will bring the coupon number, you need to just type the coupon number, it will match, and then patient will get specific discount based on the coupon creations. I'll save. I just click on the save button. Your invoice has been generated. Basically, it's done. So I will redirect. I'll redirect to the previous screen. I'll just go back to my appointment screen. So what I have done, I have done from the doctor wise appointment. There are the other option called multi doctor wise appointment. So where you can select multiple doctors in one screen. Front office normally they like this option. So 3 doctors I have taken. So Fatima only has an appointment. Other doctors they don't have. The results not showing here on the specific day. I can jump to any other day also, by the way. There is an appointment I took for Abdullah. I did the billing, so I can reveal it again, but I cannot delete because as I billed it. Okay, so this part is done now. Now, what is the purpose of nurse module? Nurse basically what they will do, they will record their entire clinical notes. Once they click on the nurse module, they will redirect to today's patient list. As I logged in with super admin, that is what I am not redirecting because it doesn't know that which screen, which patient list I have to do. So but as a nurse, based on their roles, they will see only their specific patients. Suppose this patient, the nurse has 2 patients now, Abdullah and then Abbas. So this one is already done. You can see it's out, in out is done. So another icon you can see here, that in. So as soon as patient will come to the vitals room, you just need to click to the in button. I have started taking the vitals for this patient. So doctor will be knowing and other also will be knowing. Treatment history for this patient only one. Okay, next step is treatment. Treatment is what, like, where doctors are putting orders. It will come back to nurses to carry out the order. So the time they will be doing the activities, they normally record. So I'll show you once I'll put an order, then I'll show you how it comes. Consumptions, basically the consumables or any other items they're using, those items to be recorded. To add the items on the billing screen, normally there are 2 types of activities. One is that you can see, I'll just select the department because it is related to the store. So this portion basically related to the inventory management system or store management system, where each and every items you are using, regardless you are using for your own purpose or you are using for the patient. So for the patient, suppose you are using PP or injections or IV saline, then those consumables you can charge to the patient, depends on the business rules again. So if you want to charge, you have to put it billable, then it will go to the billing screen. If you don't want to, suppose gloves or tissue papers, those are the things you do your own internal department consumptions. So you can select as consumptions, and you don't need to charge to the patient. I'll just see whether there is any item. The items are not there. Pharmacy, is there any? The products are not added anyway. So I'll add the products. I'll show you later. Procedure entry. In the procedure entry, nurses, if they're doing any procedure for the doctors, they can add here. Suppose I'll adding a laser procedure for this patient. So fractional laser CO2. This procedure will go to the billing screen showing the billing status is pending. So it will go to the billing screen, and front office will collect the bill from the patients. Progress notes. There are multiple ways of taking the progress note. There are two progress notes we have added here. One is that subjective objective assessment and planning SOP format. And again, you can use that voice recognition and to capture the details. Nurse notes. This is added just to make their life easy. They can copy paste from some other places if they want. They can use the Word tools and they can save the data. In the forms part, you can see multiple forms are there. Basically, all the standard forms we have added. Morse fall scale form. So history of falling, then the score. You can record your score older than 60 years. So this is again the standard form for Morse fall. Pen scale form is also available. Pen scale, then face where it is, all those kind of things. And then we have Humpty Dumpty. Basically Humpty Dumpty for the kids, their pen scores and others. So those kind of things we can also record. So basically all the forms required we have here. Surgery consent form, and consent form we have separate tab for capturing all the consent. So normally most common forms, yeah, I'll just take a look of the forms how it happens. So I'll take the consent form. You can see that you can take the consent, and then it has basically Arabic and English both part. So as my translation that is on, you can see it has both part basically. If I say high risk, and then the main part is that you can capture your signature here. It is fully entirely paperless. You don't need to have any papers in your medical center or hospitals, and then just save it. So after doing all the forms, you can come to the all forms and you can get the details of the forms you have entered. There are many other parts. Suppose they can see the appointments. Basically nurses, they can see the appointment also. They can see the appointment list, what are the appointments are available for today. And then there are other things. Suppose the store management, bed management, all those kind of things. So store management, probably I don't have the access, otherwise it would show here the store inventory management also. So I have covered now front office, nurse CMR. I'll go to the doctor CMR. I'll show you that how doctors are entering their clinical notes and how user friendly it is. Yeah, ladies and gentlemen, I'm going to show you the doctor CMR. So basically what we did previously, we did the billing and appointments from front office again, just to review once again. And then we have seen that nurse EMR, where we can do the nursing activities, clinical notes. We can see the appointments of the patient. We can see the patient list, and then we can choose the patient from where we are redirecting to the nursing EMR. Let me show you the doctor CMR. After login to the doctor CMR, normally it will redirect to today's patient list, role based access again, based on the doctor's access. As super admin doesn't have direct access to this patient list, that is what I have chosen from today's patient list. So there are two patients. Today we have taken two patients for their appointments, and then we did the billing, and then we completed the nurse CMR. Abdullah Alwadi, we can see the nursing EMR part, that what nurses have captured. They have done the height and weight, and then other informations whatever were entered you could see here. And there was a procedure which was entered by a nurse, fractional laser CO2. The payment status is pending because we didn't get the payment for this item. I'll go back to the billing screen after a while, and then I'll show you that how to do the billing again for the pending bills, and this payment status will be changed to the paid. Similar to the nurses, there are a couple of screens you could see. Treatment summary is all the summary of the patient's previous history. What I'm doing that I'm taking another patient, Abbas, who has more visits. So we could see here 1st of June, 25th of May, and then 22nd. There are a couple of we could see before that there are more visits actually for this patient. But the other one, the clinical notes were not entered for this patient even, I believe. Let us try to put the clinical note for this patient. Yeah, nothing has been entered for this visit. So what we are going to do is we will be adding some of the notes for this patient. So for the complaints, and you can see again, this is the beauty of our system. We Our aim was to have all the clinical notes, clinical information in the single screen. I'm just scrolling down. You could see here chief complaints, systematic examination, whatever. It is customizable as per the business rules or the requirements. But as per the National Health Regulatory Authority, there are few things are mandatory. All of you know. Other than those, we can do the customization based on the business requirements. I'll be adding some of the information. Again, I can go back and I can do with the voice recognition. Patient is having fever for last 3 days with severe abdominal pain. Similar way, we can do the other examination and then provisional diagnosis, medical history, current medication, and the treatment plan. All those things can be captured through this voice recognition tool. Then you can do the follow up. Yes, when we need to do the follow up, maybe next week, we are just putting a date. Then follow up text if you need to require to enter some of the information. Then close and discharge. What is that normally? The disposition type. So in the disposition type, how the patient has been discharged, the close or discharge, and then or it is booked for admission or the book for surgery. We can capture few other information, the pain scale, which can be overwritten by the doctor basically. So the patient had moderate pain, and then we can change it to severe pain. So what I'll do, I'm thinking that I'll go back, I'll do the same patient just to keep the same track, because we were uh, we were entering patient details for uh, the patient name was Abbas Al Awadi, I believe. So better to capture for him, because we could see that we entered the allergy for this patient. And then we'll be going to the complaint screen. Same way, just let me take again. Patient is having fever and then abdominal pain for last 3 days. We'll be adding the pain scale again, severe pain, because doctor is over in the pain scale here. We could see that moderate pain it was there. Now we are putting actually more. Allergy, the patient is allergic to food, we'll put the allergic to suppose what, beef or milk or beef. Then ICD-10, again, that you know, the ICD is international code for diagnosis, where we have 42,000 diagnoses out there we captured. And the beautiful part is that as soon as I'm searching, it's loading the similar diagnosis within fraction of a second without having difficulties. I'll be choosing typhoid fever for this patient. My diagnosis is done with the diagnosis code. Then the medicine, NHRA approved drug list are added here. Suppose I'll be ordering Panadol, basically my favorite medicine. So Panadol oral, and then how many? Two tablets for once a daily. For how many days? 7 days. Okay, so my prescription is done, and then once it is done, later after saving, you can see from here, and you can take the printout, or you don't need to do the printout. Basically, it will go to the pharmacy, and then pharmacy can bill from there. And if you don't have the pharmacy, then you can take the printout and give it to the patient. Again, same screen. I'm not navigating any other screen. Same screen. I'm ordering for the patient. Suppose CVC, my lab order, and it has connected to the pharmacy lab module, where this order will go, and then lab will carry out all the activities related to that. It has machine integration also, so the order will go automatically to the machine by directional integration, and the result will come back from the machine itself. Radiology order, I'll just see is there any other order. Suppose MRI, uh, maybe X-ray. Unfortunately, it's not there. CT. Okay, I got one. This is done. The price. Okay, so the radiology order has been added. Now I'll show you that there's an already order from the nurses laser pocketing, and I'll be adding another laser. Suppose 3 session. Okay, so I'll put in here 3 quantities, and then I'll save it. So one more laser procedure added, and the package is that normally this is absolutely a good part for the doctors, that they can order packages. Suppose that you can create a package where one consultation on lab, on radiology, and couple of other procedures together, and then you can create a package, and then I'll show you how to create the packages and where you can define a price. And once the patient will come, the item they will be taking from there, the items will be reduced, and next visit you can see the same package with the reduced items. Anyway, I'll just save and authorized. My clinical note is done. Whatever I have entered, I can see it here. And the payment status, I could see as a doctor that these are the payments are not done, so it's showing pending, pending, pending payment status. Means there are orders given, but it is not at paid, because all the items now redirected to the billing screen, where front office they have to generate the bill for this patient. So nothing is missing out, no financial risk. Each and every items you are capturing, it is going to the billing screen, and front desk they're very aware about the items, what they have to charge the patient. Forms, again, the very much used form is a leave form, which is called medical certificate or the sick leave. So the patient reported to sick, I'll just do one. I'll show you that how fast you can do that. Two, already my diagnosis captured, because I put the typhoid patient for this patient, and just save it. My sick leave is done. And I can get the sick leave certificate from here. This is the sick leave certificate. If I print it, it will show with the whatever logo you want to put, your company logos and all. uh, and see it is having the signature and stamp of the company also. Prescription, the items I have ordered, Panadol, and you can capture signature again. You just need to take the printout and give it to the patient. Otherwise, it can be collected from the pharmacy itself. Resulted is what that where the lab orders. I have ordered some. I have ordered basically CVC. So the result, once the result is done, I can see from the laboratory module from here. Consent forms again. The new as consent forms are there similar to the nurse we have seen. Even doctor they can do the consent form. That resulted. There is an order, but basically it's not. There is no result, so it's not showing here. Okay, I was showing the consent form. Same. The all the consent forms are there. We can do that. And another part is that in the form we can see that body marking is what where you have the body part and you can mark that suppose you need to do some procedure somewhere and you can write it and the activities what we are going to do that. And another form is the dental teeth marking for the dental department. Normally you can use it, suppose this is the place you want to do some root canal and this tooth maybe you need to do some other thing. So 1 2 I have, and I can write the details what I'm going to do that. uh, So, in a short, again, so the main purpose of this module is documenting the clinical notes where doctor can see the list of patient very easily. They can choose the patient from there, and then they can view their previous history, clinical history. Complaint screen is a single screen where they can capture all the information in one single screen. They can also see the appointments from here. They can make their favorites. So when I was entering the things, I could make the things favorite. Suppose this is my item, I can make the favorite, so next time it will come easily. And another part is that this portion I can make the template, add template. I can do that. Suppose the patient is coming with fever, I can write all is required for treating a fever patient. And then next time I'll go to my favorites patient favorite list and I will collect from here. I think there is I don't know, there is only one is there in the favorite list, and then I can choose from here and then my data will be done from here. So I don't need to enter all the information, I can use my favorites. So this is the part of doing of add template. So then add template is done. I will just go back to this patient list. So two patients data are entered now. I'll show you next screen whatever we have ordered now, how it is redirecting to the billing screen. Now I'll take you through the front office again because the orders we have provided. So we'll see that how it is capturing on the billing screen. So on the front office, you can see the billings side. So on the billing side, procedure billing, and I'll take the patient under Dr. Fatima Abdullah Al Wadi. So we could see here that the orders we provided, we ordered for this patient, the CVC lab already here, then the ultrasound, and then all those obstetric fetal ultrasound, laser pocketing, fractional. So if I want to delete suppose one, I can delete from here because patient is not going to do that. But it's not deleting forever because it's a doctor order. I cannot delete forever. So it will be there on the pending list again. Uh, and now if I want to give the discount similar way, I can change to cash, insurance, and their orders is showing already pending. So I'll just generate the bill generated, tax invoice as per NVL has been generated here. Within maybe milliseconds, you could see the bill has been generated. No hiccup, no slowness. Although I have connected with my mobile hotspot, it's coming from the cloud. Okay, now the bill was generated. I'll go back again to the procedure billing. I could see that 1 2 3 4 is done already. Okay, so there is pending bills, no pending bills for this patient. And there are other things like package billing with visit, package billing without visit. The patient who require a package but not a visited. So without visit, we can create the package over phone even, and they can send money through benefit pay or any other mechanism. Once the money is received, you can just generate the package billing without a visit. So visit is not created, but the package generated, and the amount will go as an advance. Package billing with visit, you can create visit and then you can take the package from the patient. uh, Patient management, patient registration, you can see all the patient who are registered here, that are whole details. And any point of time you can go to the patient and then you can edit the bill, edit the patient details. So the list of patient we have registered, as of now all the patients are here. We can edit, we can change the patient password and all. And then general advance we have, so kind of advance we are collecting from the patient without against any services. So we are just taking the money for future activities, so you can collect the general advance from here, general advance entry. And then the list of advance you have collected, you can see from the advance list. There are no advance as of now. uh, and then if you want to refund the general advance, obviously you can do the general advance refund entry. And there is other refund also, charge refund. If there is any refund out there, you can do it from here. And then you can see the report. This is the front office, they have the option to see the report, like today's collection report. They can see I have collected this amount. I can see that 408 gross amount, then there's a discount, and then if there is any other tax, all the details, the status of these bills are paid. And I can see more like audit kind of reports from the view option. So it will show you that what is the details of this. There is a patient pay amount is paid, and then there is any discount or anything. All the small nitty gritties, all the elements are showing here. There are how many items were billed. There are four. There are CVC. These items were billed on this invoice. Each and everything, basically you can do it for the audit purpose. And there are many other reports, suppose collection report, then invoice, then package billing, package items, package bill refund, how much you refund from the package consumption report, how much you consume under a package, then refund list, user closing, basically the day wise closing. So once the collection is done from a specific cashier or the receptionist, they can enter their information. This is the total collection, and they can enter the denomination and you can save it. So this will go as user closing for this patient, and then it has to be reviewed by the supervisor again. Then appointment log, we can, the details appointment logs are there, all the reports relevant to the appointments. You can see booking log, then booking delete log, procedure booking log, procedure booking delete. So each and every elements, each and every activities related to the booking, you can capture here, who deleted, when it was deleted, when the appointment was taken. So you can see each and every items under the booking log, it is showing here. There are status in, out, the patient is inside, outside, all those kind of things. And there are few other things related to the front office. I'll take you, because they have to use the role based system. So based on their activities, it will show more of their functions. So I'll show you another time with more details about the front office, how to do the insurance bills and all. Thank you so much. Welcome back. We will be showcasing other modules uh, which are available here. You can see lab, radiology lab. It has integration with the lab machines, LIS. Insurance, store or inventory management, finance and accounts, human resource, masters, reports, operation theater, and token. uh, what happened with our warders? So we provided one warder. I'll just take it in lab module right now. So lab module, as soon as logged in, I will go to today's patient list. I can see this is the patient where we had a lab orders CVC. So you can see simple screen 1, 2, 3, 4, 5, 6. It looks simple, but it has very uh, a sophisticated process to do the entire lab activities. What you do, collecting from the sample to sample authorization. So the process will be carried out through 1, 2, 3, 4, 5, 6 steps, and in the middle of the sixth step, we can send the data to the lab, and the lab will be getting back with the proper result. There are other items, suppose how you create the lab group and on all those parameters and all. So I'll not show you the full modules. It will take time. So we'll be doing only a module related to lab for showcasing their entire activities. Radiology is same. If I go to today's patient list, I can see I am not sure whether we order any, but let me see if I go back to there was an order basically. So Abbas and this, so we can do the report for them, result entry, and it has to have the connection to the packs. So once pack is connected, the image will be replicating to the to the our RIS system, and doctor can view the image and report from there. Then we have insurance is a full-fledged insurance module, revenue cycle module, where you can do the patient insurance card. You can enter all sort of insurance details here with their price tariff. I'll just show you with the edit option. So insurance and CPR, all those kind of things. And then the insurance audit we have, we can see the list of audit to be done, insurance claim confirmed audit, then insurance authorized, step by step process to do the insurance audit process till to submit to the insurance companies, and then insurance send audit. So once the audit is done, you can send as PDF, or it will generate the XML file. You can just send to the insurance company. Reports, all the reports, general reports, authorized report, and all. And then the claim settlement, obviously. Claim reconciliation also there. Claim settlement is there. Claim related to the insurance is a proper revenue cycle management, where you can do start to end process of insurance department activities. Then store management. Before going to the store management, I'll show the pharmacy because there is an order. Pharmacy billing. If I go to the pharmacy billing, the date has been changed. Basically, I was doing the demonstration. The date has been changed now to the another date. So there was an order on 1st of June. Probably I could see. Not sure there was any lab orders. Looks like no, there is no. Sorry, there is no pharmacy order. Otherwise, we could see the pharmacy here. And then for outpatient, we can sell any medications directly as a pharmacy. Sometimes patients they are coming directly to get the medications from outside prescription. You can just search with the patient medications details from here, Panadol, and then if it is our existing patient, otherwise we can just take direct patient. Any other patient we can create as sample patient, and then we can do that. So normally it's called OTC. So OTC patient we can create and we can do that. So here again we can do the billing from here, and it will show the discount and all those kind of things. So direct selling from here, you can scan the barcode and you can sell from here as well. And then the purchase request, you can request for an item from the internals to any other sub departments, and it will go to the pharmacy. They can dispense the item, and they can do the purchase request entry, and then they can do the stock transfer. Those are options are there. Purchase order, you can generate the purchase order again to the pharmaceuticals company, and you can get those items. And then purchase order entry, GRN, all the activities similar to the central store, the options are available. Creating a product, medicine category, all the medicine category are available here. I'll just go to the edit option. I'll show you that what is that is the drug and which kind of medications. And then medication supplier, we can create the supplier here, and then the reports are there obviously. collection, all the collections report for today's pharmacy sales, and then user closing. It is similar to billing and then pharmacy altogether, and the reports, all the reports you have, and the store management for doing the consumptions, because pharmacy itself it's requires to acquire some items from the center store, and they will be doing the internal purposes, and they can do the stock transfer, all those. So it's a again full-fledged pharmacy module. I'll go back to the center store or store inventory management. Here again you can have the purchase request from the sub store, nursing department, or any other departments available in the hospitals. They can request the item to the central store, and center store they can add, they can approve. Before that it will go to the supervisor or manager has to approve those items, then it will go to the central store. So central store they can accept the request, and they can do the stock transfer. I'll take separate session. I'll just giving highlight of the modules, touch point of all the modules. I'll take individual modules separately and will show the full demonstration. Finance and accounts, human resource. Again, human resource, you can do the all human resource staff entry, timing, and then staff list, full suppose the entire information of a staff who join in your clinic or hospitals, then their signature, education, work experience, joining details, upload their documents, leave policy, salary setup, each and every information related to the HR management. You can do it here. Leave management, leave type, leave policy, leave entry. Attendance, obviously it is connected to the attendance machine. The data will be captured from the attendance machine. It will be coming to the system, and then you can do the late entries, early out, all those kind of things. Payroll, obviously you can generate the payroll from here. You can create the department, you can create the designation, you can create the specialist. So entire HR management system available here in our software. I'll go back to show you the master, all the masters which you require to create. Suppose package creation, package, you want to create all the, see the packages, how many packages are there. You can create the new packages itself. Then package entry, you can create the entire package, lab radiology, and you generate the package from here. And then pharmacy related, the medicine type, medicine company, and then insurance, all the insurance, TPA provider, insurance company, card holder, provider, discount, insurance price list, insurance price entry, all those kind of things. Then booking, then I have operation theater, charge component, all the types of charges you have, you can create from here. Market component, and then send SMS. We can send SMS through for each and every event. Suppose you can send SMS while you are generating the appointment, you can do that. On the prescription is generated, you can do that. Billing generated, so SMS can be sent to the patients. HR component, tokens management system. We have the token management system built in. With this system you can set up the token management from here itself. And the reports, n numbers of reports are available. The patient list, you can see the entire patient list. Then to user closing, the user who has done the user closing, you can do the reprint from there. User closing reprint. And then front office collection, front office collection, all the collections, today's collection, invoice, refund list, package billing, package entry, package bill, package cancel list, all those kind of reports. uh, Accounts report, daily collection, payment mode, service wise report, service wise summary report, bill rest, tax report. As per the NVR, it is proper format of the tax report. Procedure wise income, previous income report, monthly summary, and then the pending bills. So we have covered almost all the modules. I'm not going through the each and every elements of administrative modules. Basically, I'll show you a separate demo for each and every modules which are pending. So we went through for front office, nurse CMR, the doctor CMR, and then we just give the highlights on the other modules. Thanks for attending to this demo session.